Top 4 natural vitamins to heal lower back pain after 60. You wake up in the morning, swing your legs over the side of the bed, and that familiar sharp pain shoots through your lower back. You wince, take a deep breath, and wonder if this is just how life is going to be from now on. You're not alone. Over 80% of people over 60 experience chronic lower back pain that affects their daily activities, their sleep, and their overall quality of life. Lower back pain after 60 isn't just about getting older. Yes, our bodies change as we age, but the pain often comes from specific issues that we can address. Your spine is made up of vertebrae, discs, muscles, and ligaments all working together. Over time, several things happen. First, the discs between your vertebrae start to lose water content, making them less flexible and more prone to injury. Second, inflammation increases throughout your body as part of the aging process. Third, your bones may start to lose density, putting more stress on your spine. Fourth, your muscles and ligaments become less flexible and supportive. The good news is that targeted nutrition can address many of these underlying causes. When you give your body the right building blocks, it can repair damage, reduce inflammation, and strengthen the structures that support your spine. That's where these 4 vitamins come in. Before we begin, don't forget to subscribe and turn on the notification bell. Now let's get started. Number 1. Vitamin D3. Let's start with vitamin D3. Vitamin D3 plays a crucial role in reducing lower back pain through multiple mechanisms. First, let's talk about the bone connection. Your spine needs strong, dense bones to support your body weight and daily activities. Vitamin D3 helps your body absorb calcium from your food and directs it to your bones where it's needed. Without adequate D3, your bones become weak and brittle, leading to compression fractures in your spine that cause severe pain. Here's what many people don't know. Vitamin D3 also acts as a powerful anti-inflammatory agent in your body. It regulates immune system responses that can cause chronic inflammation around your spine. When inflammation decreases, pain often follows. The muscle connection is equally important. Vitamin D3 receptors are found throughout your muscle tissue. When you're deficient, your muscles become weak and more prone to spasms. Strong core muscles are essential for supporting your spine and preventing pain. Most adults over 60 need between 1,000 to 2,000 IU of vitamin D3 daily, but the exact amount depends on your current blood levels. The best way to know is through a simple blood test that measures 25-hydroxy-vitamin D. You want your levels between 30 to 50 nanograms per milliliter for optimal benefits. Natural sources include fatty fish like salmon and mackerel, egg yolks from pasture-raised chickens, and of course, sunlight exposure. However, as we age, our skin becomes less efficient at producing D3 from sunlight, making supplementation often necessary. When choosing a supplement, look for D3, not D2. D3 is the form your body naturally produces and uses most effectively. Take it with a meal that contains some fat, as D3 is fat-soluble and needs fat for proper absorption. One important note about safety. While vitamin D3 is generally very safe, taking too much can cause calcium to build up in your blood. Stick to recommended doses and work with your healthcare provider to monitor your levels if you're taking higher amounts. The practical tip here is consistency. Vitamin D3 builds up in your system over time. You won't feel better overnight, but after 6 to 8 weeks of consistent supplementation, many people notice significant improvements in their pain levels and overall energy. Number 2. Vitamin C. Most people think of vitamin C for immune support, but it's actually essential for building and maintaining the structures that support your spine. Your spinal discs, the cushions between your vertebrae, are made largely of collagen. Think of collagen as the scaffolding that holds your discs together and keeps them flexible. As we age, collagen production naturally decreases, leading to disc degeneration and pain. Vitamin C is the key cofactor your body needs to produce new collagen. But vitamin C's benefits go beyond collagen production. It's one of nature's most powerful antioxidants, fighting the free radicals that cause inflammation and tissue damage. Chronic inflammation is a major contributor to back pain, especially the kind that persists for months or years. Here's something fascinating. Vitamin C also plays a role in nerve function. When nerves in your spine become compressed or irritated, they can cause shooting pains down your legs or numbness in your feet. Adequate vitamin C helps maintain the protective covering around nerves, reducing these symptoms. The research on dosage shows that most adults need much more than the basic recommended daily amount. While the RDA is only 90 milligrams for men and 75 milligrams for women, studies on back pain relief use doses between 500 to 1,000 milligrams daily. At these levels, vitamin C can significantly impact collagen synthesis and inflammation reduction. Natural food sources are abundant and delicious. Citrus fruits are the obvious choice, but red bell peppers actually contain more vitamin C than oranges. Strawberries, kiwi fruit, broccoli, and Brussels sprouts are all excellent sources. The key is eating a variety of colorful fruits and vegetables throughout the day. If you choose to supplement, there are a few forms to consider. Regular ascorbic acid is fine for most people, but if you have a sensitive stomach, look for buffered forms like calcium ascorbate or magnesium ascorbate. These are gentler on your digestive system and can be taken on an empty stomach. One unique benefit of vitamin C is that it enhances the absorption and effectiveness of other nutrients. When taken with iron, it improves iron absorption. When combined with vitamin E, the two work synergistically to provide even stronger antioxidant protection. The practical application is timing. Your body can only absorb about 200 milligrams of vitamin C at one time. If you're taking higher doses, split them throughout the day. Take some with breakfast, some with lunch, and some with dinner for maximum absorption and sustained blood levels. Remember, vitamin C is water-soluble, so excess amounts are excreted in your urine. This makes it very safe, but it also means you need consistent daily intake to maintain optimal levels. If you're finding this information helpful and can see how these vitamins might benefit your back pain, I'd love for you to subscribe to our channel. We're building a community of people who are committed to aging well naturally, and your support helps us continue creating content that makes a real difference in people's lives. Number 3, vitamin B12. Now let's discuss vitamin B12, a nutrient that's critically important for anyone dealing with back pain that radiates into their legs or causes numbness and tingling. B12 is essential for nerve health, and many back pain sufferers actually have underlying nerve issues that B12 can help address. Your spinal cord and the nerves that branch out from it are covered by a protective sheath called myelin. Think of myelin like the insulation around electrical wires. When it's damaged or thin, nerve signals don't transmit properly, leading to pain, weakness, and strange sensations. Vitamin B12 is essential for maintaining and repairing this myelin sheath. But here's the concerning part. B12 deficiency is extremely common in adults over 60. As we age, our stomachs produce less acid, which is needed to extract B12 from food. Additionally, certain medications like proton pump inhibitors for heartburn can interfere with B12 absorption. Many people are walking around with suboptimal B12 levels without knowing it. The symptoms of B12 deficiency can mimic or worsen back pain issues. You might experience shooting pains, electric shock sensations, numbness in your feet or hands, weakness in your legs, or balance problems. These symptoms often develop gradually, so people attribute them to normal aging rather than a treatable deficiency. B12 also plays a role in red blood cell formation. When you're deficient, your cells don't get adequate oxygen, leading to fatigue and slower healing. If your back muscles and discs aren't getting enough oxygen-rich blood, they can't repair themselves effectively. The research shows that adults over 60 should aim for much higher B12 levels than younger people. While the RDA is 2.4 micrograms, many experts recommend 25 to 100 micrograms daily for optimal nerve function and pain management. Natural sources include animal products like fish, meat, eggs, and dairy. However, the B12 in food is bound to proteins and requires adequate stomach acid to be released and absorbed. This is why supplementation is often necessary for older adults. When it comes to supplements, the form matters. Cyanocobalamin is the most common and least expensive form, but methylcobalamin is more bioactive and better utilized by your nervous system. Sublingual tablets that dissolve under your tongue bypass the digestive system entirely, ensuring better absorption. Some people benefit from B12 injections, especially if they have severe absorption issues. These are typically given monthly and can rapidly restore B12 levels. If you're dealing with chronic back pain, it's worth asking your doctor to check your B12 levels with a simple blood test. The practical tip here is patience. While some people feel better within weeks of starting B12 supplementation, nerve healing takes time. It can take 3 to 6 months to see the full benefits, especially if you've been deficient for a while. Number 4. Vitamin K2. Finally, let's talk about vitamin K2, the forgotten vitamin that plays a crucial role in bone health and pain management. While most people have heard of vitamin K for blood clotting, K2 has a completely different function that's especially important for spinal health. Here's the key concept. Calcium is essential for strong bones, but it needs to end up in the right places. Without adequate K2, calcium can deposit in your arteries, joints, and soft tissues where it causes problems, rather than in your bones where it's needed. This misplaced calcium can actually contribute to joint pain and stiffness. Vitamin K2 activates proteins that direct calcium to your bones and teeth while preventing it from accumulating in soft tissues. Think of K2 as a traffic director, making sure calcium goes where it should and stays out of where it shouldn't. But there's more to the story. K2 also has anti-inflammatory properties. It helps regulate immune system responses that can cause chronic inflammation around your spine and joints. Less inflammation means less pain and better healing. The research shows two main forms of K2 in supplements. MK4 is the synthetic form that requires higher doses, typically 15 to 45 milligrams daily. MK7 is derived from fermented foods and is more potent, requiring only 90 to 180 micrograms daily. MK7 also stays active in your body longer, providing more sustained benefits. Natural sources of K2 are somewhat limited in the typical Western diet. Fermented foods like natto, a Japanese fermented soybean dish, contain the highest levels. Hard cheeses, especially aged varieties like Gouda, are good sources. Egg yolks from pasture-raised chickens and grass-fed butter also contain meaningful amounts. One of the most important interactions is between K2 and vitamin D3. These two vitamins work together synergistically. D3 helps you absorb calcium from your food, while K2 makes sure that calcium gets deposited in your bones rather than your arteries. Taking one without the other is like having a car without a steering wheel. Many experts now recommend taking D3 and K2 together, and you can find combination supplements that provide both. A typical ratio is 1,000 IU of D3 with 100 micrograms of K2 MK7. Safety considerations are important with K2. If you're taking blood-thinning medications like warfarin, you need to be cautious with K vitamins as they can affect clotting function. Always check with your healthcare provider before starting K2 supplementation if you're on any medications. The practical application is consistency and combination. K2 works best when taken with D3 and with a meal that contains some fat. Like other fat-soluble vitamins, it needs fat for proper absorption. Lower back pain doesn't have to be an inevitable part of aging. While we can't turn back the clock, we can give our bodies the nutrients they need to heal, repair, and maintain the structures that support us. These 4 vitamins, vitamin D3 for bone strength and inflammation reduction, vitamin C for collagen production and antioxidant protection, B12 for nerve health and healing, and K2 for proper calcium utilization, represent a natural, science-backed approach to managing back pain. The most important thing is to start somewhere. Pick 1 or 2 of these vitamins that resonate most with your situation and begin there. As you start feeling better, you can consider adding others to your routine. Remember, healing takes time, but every day you're giving your body proper nutrition is a day you're investing in your future mobility and comfort. You deserve to live without constant pain, to sleep well at night, and to enjoy the activities you love. This video is intended for informational and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you have any symptoms, discomfort, or health concerns, please consult your doctor or a qualified healthcare provider. Always talk to your physician before making any changes to your diet, supplements, or lifestyle. If this video has provided valuable insights for your health journey, consider giving this video a like and subscribe to our channel. Until next time, stay healthy and stay hopeful.